Okay, the next panel that we're going to be going over here is the tick-borne. Now, I got to tell you, I've been dealing with chronic Lyme patients for years and years and years. My opinion, along with most doctors that are somewhat holistically minded, are that you're only getting Lyme disease in a compromised immune system patient, period. If your immune system is strong, just like the COVID, you don't have to worry about it. It comes in, your immune system handles it. It's a compromised immune system that gets the Lyme disease or these co-infections. I also want to tell you that there's like 67% of the testing that's done, which is the standard ELISA test, and your Western blot will miss Lyme disease. If you've gotten those and you didn't get this, you could easily be told that you don't have it when you do. The other thing that you want to know is the CDC does not recommend that you must do antibiotics. It says that it depends upon the clinical need. I also can tell you I know plenty of doctors that have shown, and the research shows that up to 70% of people that have done the antibiotics will still continue to get chronic recurrent Lyme, or the co-infections. Now, why is that? Because none of those protocols, if all we do is bombard you and drop the Hiroshima bomb drop of antibiotics on top of you, and did not address these other factors and the overall health of the patient, you're never going to get this to clear properly. And the three systems that take the hit from this: carditis, heart issues; arthritis, joint, I call it muscle joint; and lastly, neurology, brain, spinal cord, and nerves. Anybody also that has a pretty rapid shift over a time frame usually has some type of a tick-borne illness or some type of a co-infection going on, and it can rapidly show up inside the person. I've had people with big swollen knees that have been told that it's ligament damage, chronic joint problems, when realistically what it is, it's the chronic bug inside of there. So we test for Lyme, we test for borreliosis, we test for Lyme. We do this Lyme immunochip. It's much more in depth. We're looking at the peptides, not the proteins, which makes it way more accurate. And we also don't only go by the CDC guidelines. We go by the CDC guidelines and also the guidelines established from this lab to determine whether it's positive or not. And then you're going to get these different bands, and we run through the bands. It says green, you're good; moderate, not so good; and then high risk. And then from there, we would let you know whether we think that there's a positive here or not, and then what you may do, whether we need to refer you out or not, and we can talk about it. We also look at the Lyme. We break this down into the immunochip IgM and IgG. We look at both. Again, IgM is a more short-term, 0 to say 3-4 month antibody picture, and IgG is a longer-term picture. And you get to see, hey, is my immune system being stressed by this pathogen over and over and over again? We also will show you the CDC Lyme and also the lab Lyme result that we get from here, whether it's negative or positive. And then you also get the Lyme PCR. These are just very different, we'll call them species of the Lyme that are not tested at all with the ELISA or the Western blot. We also look at Borrelia. We look at the IgM Borrelia, which is the short-term systemic picture. We also look at the IgG Borrelia, which is a longer-term immunochip picture. And we look at some spin-offs of the less common Borrelia chip again. We also look at Babesia. We look at them in the IgM. We'll also let you know whether we think that you're a positive result or not. And we also look at the IgG, which is the long-term picture. We also give you the Babesia not so common forms. They're tested as well. Bartonella, we look for the IgM, the IgG, and also through the microchip testing. And then we also look at some other bugs, Ercolliciosis, and then also Anaplasmosis. And we'll let you know whether we think that, whether they're positive or not. We also look at Chlamydiophilia, pneumoniae, we look at mycoplasma, and we look at Rocky Mountain spotted fever, and then last we look at tularemia. So these are all of the tick-borne, and many times, just so you know, when you get bit by the bug or by the spider or even by the mosquito, you get more than one bug that comes into the system. It's very common. So if all we do is focus on Lyme and we don't look at all of them, you never get the best result. If we also, again, do the typical ELISA test and the Western blot, 67% of those cases are missed, and they don't test for any of the other co-infections. So we got you all covered here. It's a very in-depth panel. I do include this usually with most specialty cases, especially in the beginning, because I find that this is a major player in uncovering and getting you the best root functional cause diagnosis to then establish the best plan. Thanks. Have a great day.